Welcome back, YouTubers, to my channel. If you're new to my channel, I'm AspieAnswersAll, and I welcome you all with open arms. I am now bringing out about some of the series of the Let's Talk, which I feel really important right now, especially to the one I'm going to be talking about, especially based on men's health. So bear in mind that the reason to why I'm doing this is obviously, as I said, that there's not much knowledge and know-how, or just not much awareness about different, everyday health awareness areas that needs to be addressed based on the men's health, especially because obviously it's always solely relying on the woman's health side of things. There could be a lot of reasons to why this is happening, but as we know that we need to just address these somehow one way or another so that we can educate ourselves and be sure to be ready to know what we know when we need to know, when it comes down to knowing the signs and symptoms and everything else for our loved ones, especially our male partners, because obviously we need to look after them and hopefully they can just look after us in good and bad times, regardless what it may be. So no further ado, before I begin, as I said before, I am no everyday Joe Blogs. This is a disclaimer, or shall we say, I'm not your doctor, I'm your everyday Joe Blogs, and that's no matter what I say or do, I'm just doing it based on my life experiences, knowledge and know-how on how I manage my everyday personal struggles of my territory of Prostate syndrome and the like, so that hopefully it gives you the lowdown on what is expected of me, obviously, and hopefully with some of these management tools and techniques I bring out to you may be of value to you, or if not, of someone else that you feel might need it. But as I said, seek professional advice or second opinion if you're unsure of what's going down. And all further ado, also basically, these are going to be broken down into different topics, especially for the men's health, because obviously I want to try and address as many topics in the men's health part of my Let's Talk series, because this is important to bring it out there. So hopefully you guys will learn something along the way as I share this with you, even though they're really short and brief. But if, as I said in the very beginning, if you want further information, I can do in-depth ones based on my knowledge and stuff, based on my training and everything else that I can recall, that may be of value to you. If not, just hang tight and just listen into these ones exactly, hopefully, and it should hopefully be easily understood and whatnot. So no further ado, basically this one's going to be all about the Let's Talk men's health, prostate cancer, basically. So let's begin this before I run out of time. Just to bear in mind also that some of the statistics I'm going to be remembering from a site in New Zealand, so that we don't avoid any confusion or misunderstandings. I know that the majority of the time while I've been researching has been American based, but now I feel just to hopefully focus it on New Zealand, where I'm based at. So as we know, every year 3,000 New Zealand men will be diagnosed with prostate cancer, which is a sad fact but reality. I'll be bringing out hopefully some facts and myths about some of these different types of cancer and every other topics also to come into play with this, so that you guys can actually learn more. So let's begin this anyway. What is the prostate cancer? Obviously the prostate is a small gland, normally about the size of a walnut. It sits just below the bladder and surrounds the upper part of the urethra, which the urethra is the tube that carries urine from the bladder and semen from the testicles to the outside of the body through the penis. Prostate cancer is the presence of cancer cells or cancerous growth on the gland. In many cases, prostate cancer is slow growing and having it won't affect you, but in some cases cancer is more aggressive and can spread to your bones, liver and lungs. The signs and symptoms to look out for that are common for our prostate, while it is becoming enlarged as we age, obviously, but can also be a sign of prostate cancer. Just to notice these following signs that I'm addressing to you. Number 1, needing to pee more often, especially at night time. Number 2, having difficulty starting or stopping the flow. And number 3, dribbling or leaking when you urgently need to pee. Who gets it? Is a good question, obviously, that many people would want to know about. Prostate cancer is most common in men over 40. It is very rare in younger men though, however, but chances of developing it may increase as you get older. By the age of 60, however, 1 in 14 men will have prostate cancer. Prostate cancer also, again, can be hereditary like most cancers. If your father or brother has prostate cancer, you have a hard chance of developing it. Getting tested. If you're over 40, that's the New Zealand National Health Board, especially, and just New Zealand health organisations around basically recommends to get tested for prostate cancer every year. Again, there are 2 initial tests for this, however, for the prostate cancer, which of one is number 1, physical examination, and number 2, prostate specific antigen blood test, or PSA as they abbreviate it down to for short. In the physical examination, however, your doctor will put their finger up your bottom to feel the prostate for roughness, size and unusual lumps. For the blood test, however, you will probably be sent to a lab. PSA is a protein produced by your prostate. High levels in your blood might be caused by the prostate cancer. If both tests are showing those warning signs, then you can elect to have a biopsy where a tissue can be removed or sampled of your prostate that is then taken to confirm if you do have prostate cancer or not. Treatment options. Depending on the size and stage of the cancer, you'll be offered different treatment options yet again. For some of the best option may be monitored of the cancer, not intervene if it isn't having a negative impact on your own health. For others, one of or a combination of following may be needed: medication, surgery, radiotherapy or chemotherapy. Your doctor will help choose the best treatment for you, regardless what it may be. As I said earlier, the better the detection and prevention of anything. So that quickly ends basically this talk men's health, prostate cancer. Give me the like for thumbs up for support. Comment below if I missed out anything, or just comment below to share some stories that how you manage to go with your everyday life of your struggle with this, so that hopefully we can create it in an open discussion board for people, so that hopefully they can just be in mind that all these do exist and that we need to support one another, especially sometimes for men. Feel free to follow me on Twitter, Facebook, AspieAnswersAll. Feel free to subscribe to my channel if you haven't done so. Feel free to share these videos along to family, friends, whatever reasons it may be. And all further ado, guys, thanks for your support, thanks for watching. Do what you love what you do. Until next time, Aspie signing